Welcome back. Thank you very much for joining me. My name is Swadek Mayanja, and I am Q the Nurse. And on this channel, I bring you news, research, current events, and fun topics for nurses everywhere. It's been a little bit, but I have had a couple of everyday heroes. I've had some nurse flicks. It was a Black Panther extraordinaire. It's been blowing up. Everyone's seen it. Everyone should see it. Beautiful show. But now we're back down to business. Let's get back to business. All right. So let's just get this party started. Hey.
You'll be doing things you don't like doing in order to go on living, that is, to go on doing things you don't like doing, which is stupid. Better to have a short life that is full of what you like doing than a long life spent in a miserable way.
Hey! First story of the day. So, sepsis. Who likes sepsis? Sepsis. It's a scary disease. If you don't know what sepsis is, it's basically when an infection takes over your whole body, starts shutting down some of your organs, and you end up dying. And the problem with sepsis is it's really hard to catch because by the time you catch it, it's already in your bloodstream all over your body, and then trying to stop that, they have to hit you with some hardcore antibiotics, and a lot of the time that itself doesn't work, and it ends up taking a lot of people's lives. So what are we going to do to stop sepsis? This is a way us nurses can get a jump on the sepsis control. So the way that we're going to fix this issue is that nurses are going to work closely with the technology around us, meaning our computers, meaning our EMRs, our medical record systems, whatever you use that gives you a ding, gives you a reminder that this medication is due, gives you a reminder that you need to do this task. It is going to remind us, or it's going to give us a little ting, a little ding, whenever the computer suspects that a patient might be becoming septic, or has septicemia, or is septic. They have devised a system that uses more subtle clues from a patient's day-to-day electronic health records to send up warning flags of impending sepsis. The automated system looks for patterns and symptoms like high temperature, low temperature, low blood pressure, fast breathing, and high white blood cell counts. No single symptom signals sepsis, but certain patterns suggest this condition could be emerging. So once the computer gets all this information, and it sends you that ting, that ring, that reminder, that concern, that red box, that red check, that X mark, whatever it uses. Once it reminds you, it is up to us nurses to decide if this is worth calling the doctor, if this is worth notifying the doctor. So it says, if the nurse says yes, that this is something worth notifying the doctor, then the provider is automatically paged out of the computer system. The doctor is supposed to respond within half an hour, and the overall goal is to get a patient who might be developing sepsis antibiotics within 3 hours. So the good thing about this is that it asks the nurse, and it's not pinging and paging the doctors every 5 seconds, because we've all been in situations in which we've taken a patient's blood pressure, a patient's heart rate when they just walked up the stairs, when they just ran to the bathroom, and it was sky high. And if they were paged because the patient was walking to the bathroom, jumping up and down, doing something physically active that got that blood pressure and heart rate to go up, it'd be useless. And then we would stop listening and paying attention to the pages. That's why it needs to ask us nurses, is this like an unnatural cause? Is there something going on with this patient that you don't understand, or you don't know, or you think sepsis might be going on? Then you page the doctor. This computer system lets us know if we need to page the doctor, or if it's concerning enough that the doctor needs to be paged, the doctor will then get paged. And once the doctor is paged, hopefully within 3 hours, they get antibiotics, and this cuts down the death count. It's huge. Sepsis is a disease that's killing 250,000 Americans every year, and that is just in America. I know us nurses, we deal with alarms, bells, pings, dings all day, every day. And it is super annoying, and it is super frustrating. And I know alarm fatigue is an actual thing, it's a real thing, it's a frustration. But if this extra one more ding can help save 250,000 people, even a percentage of that number, I am all for it all day, every day. Ring, ding, and ping all you want. All right? All you want. At least that's how I feel. At least that's how I feel. All right. To a little more, not more serious, because death is death is death, but this is serious for us nurses in the workplace. So we know that the Me Too movement's happening. Okay? But in the workplace, for us nurses, it's a little bit different. All right? So NBC News, and I give it up to them because I loved this this article, this report. They interviewed a nurse, Meghann Justice, who works in an emergency room, and I'm pretty sure she's a travel nurse. And they asked her a couple of questions about sexual harassment in the workplace. And not only is it a story about her, yeah, she has some anecdotal, stories that she told, but they also looked at major studies that have shown that sexual harassment in healthcare providers' workplaces is horrendous. Is it more on the female side versus the male side? Of course! Of course it is. As a male nurse, do I know what sexual harassment is at work? No, I can honestly say I don't think I've been sexually harassed at work. Which is a great thing. Which is something every nurse, every healthcare provider should be able to say. I'm lucky that I haven't. Because once you look at these numbers, it's like, holy shit, how? Even for the men, it's crazy. But for the women, it's the majority. And it's not even a question. It's scary. All right, let's get there. All right, so Meghann Justice is an emergency room nurse, and she says that she's been called things like cute little thing, or patients have exposed themselves to her, especially when she's in the emergency room and she's putting in an IV and she has to lean over the patient. She says that these patients come into the hospital inebriated, they come in drunk, they come in after they use some crazy drugs, or just super ill. And like when she does things like put in an IV, when she does things like has to put on someone's telly and has to get really close to the patient, these patients sometimes do the crazy thing of thinking they could go ahead and grab a boob, get a quick squeeze in. It's insane. Absolutely insane. You put your scrubs on every morning, you go to work because you want to help these patients, and while you're helping these patients, they put you through that? Bullshit. Absolute bullshit. All right? But it's not just the patients, and we're going to get back to the patients, because with the patients, like I said, they are those caveats where, they're ill, they're sick, they're drunk, they're induced. It doesn't give them a pass. It's a zero pass. Absolutely not. But we're going to get back to that. What we also need to talk about is the sexual harassment nurses and other healthcare providers, mainly female healthcare providers, face when they're in the workplace from other co-workers. Yes, I'm talking to us men. Us men, you and me in the healthcare field, it is our fault. Our fault, all right? So, in the study, in the NBC News reported inappropriate conduct from their male peers or supervisors. Over the course of 7 months, women residents, nurses, and surgeons told NBC News about rampant misconduct, including vulgar comments from male physicians whispered to them in the operating rooms of anesthetized patients, propositions in hospital call rooms, and questions about their bra sizes from male coworkers. Really? Really though? Like, really? Bra sizes? I mean, 7th grade? Really? Come on. So yes, a study from Medscape was done on this exact topic on sexual harassment in the workplace, but it focused again on patients, not from coworkers, and it was done for both men and women, and the numbers are drastic, and this is what I was talking about in the beginning. So a Medscape poll asking whether these healthcare providers have been sexually harassed, they found that many more nurses, 71%, compared to physicians, 47% said yes. The poll questioned 1,455 people, 569 of which were nurses, 408 were physicians, and 68 were just some form of healthcare provider. And then they split it up by genders, and it's drastic. So 73% of female nurses versus 46% of male nurses had said yes, they had been harassed at work, and then 58% of female physicians versus 39% of male physicians has said yes, they have been harassed at work. And that's gross. in every way possible. And again, those are just the numbers from the patients, and that is only asking 1,000 nurses, physicians, and healthcare professionals. That is, because I've been a male nurse and I've heard the stories in like the nurses station. I've heard the stories when we go out after work. It happens all the time. Not to me, and I think it's crazy because I don't know. Yeah, I'm always in like an awkward position at work, but I'm in an awkward position when I'm helping clean someone up, right? I'm in an awkward position when I have to take someone to the bathroom and it's awkward and I have to stand there and watch them because they might fall over. Stuff like that is my definition of an awkward situation at work. I don't know what it feels like for someone to grab my chest while I'm trying to work, help them get better. I don't know what it feels like for someone to call me like a cute little thing or do a spin for me, honey, or all this bullshit. I don't. I just don't. Right? I'm like cringe-worthy, awkward, don't know what to say when I'm in like those bathroom situations. I don't know what I would do, say, or feel in the other situations. And the worst part about this entire story is what Miss Meghann Justice said at the end. She said it's just par for the course as for female nurses. It got to the point where she gets it all the time, so often, it is just par for the course. If that's what the profession of being a nurse, which I am so proud to be, has come to, where the female counterparts have to just deal with it. Like, that's what the situation is. They just have to deal with it. I'm kind of disappointed. Yes, I've heard these stories, but I didn't know it was this much, right? I didn't know it happened so often, all day, every day. I don't know. But the thing is, I don't know what the answer is. For the coworkers, I know what the answer is for the coworkers who were sexually harassing their coworkers. Kick them out. Get fired. Get reprimanded. Whatever you have to do, go down the policy list and just do what that policy says. Because reading policies, most policies, if followed correctly, do make sense, right? I don't know word for word what our policy is, but there's some punishment that happens. You might lose your job. You might get, suspended. All of these things happen, which makes sense, which should happen. And yes, we should report these things, and I'm not saying like the victim, the person who's getting sexual harassed, even if you're just a bystander and you hear this whispering in the OR room, you stand up and say, this is bullshit. You can't do that, number one. Number two, you take it to your manager, you take it to someone in HR, you take it somewhere so that person doesn't do that again and they get in trouble the way they should get in trouble. She said, change will start once the profession of nursing as a whole is no longer sexualized, and that's a huge point. I mean, just look at any Halloween picture from any party in the history of Halloween, and there's a sexy nurse somewhere, right? And then she continues by saying the stereotype of the sexy nurse, a lot of people just have that idea in their head, even though it may not necessarily apply. Definitely not. And then lastly, we're not all wearing short little white dresses and fishnets. Amen to you, Miss Justice. Amen to you. I respect it. I love it all the way. We got to change. I don't know how. I don't know what the answer is. And then just getting back on the patient side, the only reason I say it's a little iffy there is because if you get sexual harassed at work and you work at a restaurant, you can tell that customer, get out. We don't want you here. Yeah, if you're working at a bank, you say, get out, we don't want you here. But when someone's sick, when someone's ill, when it's a patient and it's healthcare, you can't tell the patient, get out, you can't be here. You can't do that to them. Yes, you gotta be firm and say, this is not allowed. If you do this, we can't help you. Obviously, but we can never not help the patient. It is our duty as healthcare providers, as nurses, to help the patient. So that's why I say it gets a little tricky. It sucks. I don't know what the answer is, but we need to figure something out because I can't imagine it. I can't imagine, and I hated reading that it was par for the course. Par for the course, get the hell out of here. Par for the course is staying late to document. Par for the course is you might miss a lunch here and there. Par for the course should never, ever, 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 ever be sexual harassment in the workplace. All right, I'm done. I know. I'm sorry. I'm done. Moving on. Okay, another story of a fake nurse. These fake nursing stories, these fake nurse stories really are starting to bother me. They really are starting to bother me. And this fake nurse, Miss Rivera from St. Louis, I feel like it happens so often. I literally can make an entire a video on a fake nurse every day for the rest of my life, and it just keeps coming up every time, every day, all day, every day. So the reason I'm talking about Miss Rivera, yeah, she got caught. I'm happy she got caught. She's on house arrest. She got her punishment. But the reason I'm deciding to talk about her specifically is because she decided if she's going to be a fake nurse, she's going to do it big. She's going to do it big, right? So her punishment, on top of the house arrest, on top of whatever time she has to spend in jail, if she has to do that, she has to pay back $21,500 to a staffing agency that placed her, and the staffing agency that placed her in an ICU. Homegirl hasn't been to a single day of nursing school, but she's working in an ICU. Mind you, okay, listen, I started my new nursing job, brand spanking new nursing job. I work on a tele unit, which I'm so happy for. I absolutely love it there. But, whenever I have to walk on over to the ICU to just send my, stat labs or whatever through that chute thing, whenever I've ever passed through the ICU, I get nervous. I have to take a deep breath because shit goes down in the ICU. Coming from someone that's been a nurse for just 2 years and has been through all of nursing, like I'm telling you, this shit is scary. Homegirl, Miss Rivera, has some real cojones. If she decided as her first nursing job, fake nursing job, as someone who's never been a nurse in their entire life, does not know nursing, hasn't been to nursing school, that she's going to work in the ICU, I hate what she's doing, but I respect the ball. I respect it. Because, God damn it, if she was walking in there and it took them that long where she owes them $21,500 to figure out she's not a nurse, I'm guessing she must have been doing something. Right? She must have been giving meds. She must have been doing some treatment, or else it would have been like, what the hell are you doing by that first day? Scary shit. Yes, scary shit, but respect. And it doesn't end there. She also has to pay back $28,000 to the nursing school in New Mexico, where she taught prior to her employment at the ICU. Not only was she in the ICU doing some hardcore nursing, probably the hardest type of nursing, I'd say ED, ICU more intense skills, treatments, ED more intense, like just atmosphere. Both those places are like the most intense kind of nursing you could do, but then on top of that, she's not just being a nurse, she's teaching nurses how to be nurses when herself has never been a nurse. Miss Rivera, you're insane, but you got balls. That is all I am saying. You're insane, but you got balls. Oh yeah. So a really quick story. So the Florida shooting happened. Super sad. I just want to put it out there that I did not make a video about it. I thought I should. I didn't know if I should, but then I looked at the other videos I made for the other shootings that has happened, which I'll put in a link below, but I don't even know if you want to watch it. But I've been saying the same thing for the past 2 years now. I literally say the same thing every single time. I say the same thing every single time. I don't know how else I'm going to say it. It's just a different town, a different city. Not even a different city because I'm in a different state, because I was talking about Florida a couple, like 6-7 months ago. Well, there was a shooting at the club or whatever. It's the same thing that I say every single time. So that's why I decided not to make a video. I wasn't going to be putting any new information out there. We need to make some stricter gun laws. That's what I believe. I understand people who like using their guns. I can understand the appeal, right? I want to one day go to a gun range and shoot. I think it's badass. I watch these movies we all see. I have no interest ever in buying a gun. I have no interest ever in going hunting. That's just my personal bias. I wouldn't have a problem. In fact, I don't mind having a ban on guns entirely. I know that is insane. I don't expect that to happen, but I expect something to happen. Something to happen. Because as a nurse, my job is to make people's lives better. It's to bring people back from the worst situation they've ever been back into their normal self, if not even better. That is my job. That is the career. That is what I've dedicated my life to. So when I see these crazy shootings, when I see these insane, inhumane, mind-blowing situations, and when it happens at a school, you just ask yourself, what in the goddamn world? Right? Like, why? And I can't wrap my head around it. I just said I didn't make a video about it, but I'm making it right now. I just get so... Anyways, I just had to shout out, humongous shout out, and I didn't know this until a couple of days ago, but if you knew anything about the shooter, I'm not going to say his name. He should never, I'm just not going to say his name. But if you know anything about the shooter, he did have a rough childhood. Mental illness is a huge part of this issue, of this problem, gun violence, of course it is. Yes, there's hundreds of thousands of people who have mental issues. Let's make it harder for those people who have mental issues to get guns. That's what I believe. But he had a rough childhood. He most definitely had some kind of mental issue somehow, some way, right? But both his parents died, and the mother, the woman that decided to adopt him, was a nurse. I had no idea. Yes, the woman that decided to adopt the gunman at the school shooting in Florida was a nurse. She works as a NICU. When I said this, I was like, first of all, I was like, holy shit, I had no idea. That's amazing of her, but it just makes sense because what I just said about being a nurse. Like, our entire lives, every time we see someone in a shitty situation, the first state of mind is not like, holy shit, that sucks. The first thing is, what can I do to make this situation better for that human being? That's the first thing we think. How can I make this situation better for that person? And her decision, which I think is the most you can actually give, like, in this world, is bring someone into your home, put them underneath your roof, feed them, give them everything you possibly can give them to help them become a better human being. Sadly, this situation happened. Can you put any blame on her? No, you do the exact opposite. You say you did everything you could to prevent this, right? Before the situation, he would have just been in an orphanage. He would have just been in foster care. She tried to adopt this person to make his life better, and he did that. I can't imagine what she feels. I don't know if she feels responsible. I don't know how that situation is, but I do know the instinct of wanting to help other people. And hats off to her. I'm sorry, let me just say her name, Kimberly Sneed. Kimberly Sneed from Florida. She works at a NICU. You're an amazing, amazing human being, and my heart goes out to you. So I just have to say this for you. Whatever you're going through, I am truly sorry. You need your time to, get back to being on your feet and understanding and living through the situation. But you did nothing but try to help this human being. You did nothing but try to help him. You adopted him when he was older. No excuses for him at all. But I am saying he did have a rough childhood. He might have had... I feel like most of these shooters all have some type of mental illness or some type of ego problem. You did everything you could to help this human being. It's not like you had a manifesto that you were feeding into this kid. It's not like you raised this kid and you were telling him, you should be going out and do... No, you adopted him into your family because you wanted him to be a better human being. You're amazing. You're a great human being. You're an amazing nurse. You tried to help the world. Continue doing what you're doing. And I truly, truly am sorry. Okay. So let's talk about the good things about being a nurse. Okay, we talked about sepsis. We talked about the gun shooting. We talked about fake nurses, but let's talk about the reason there are fake nurses. And you know why there are fake nurses out there? It's because those nurses want to make the kind of money, those people want to make the kind of money us nurses make. And do you want to know how much money a nurse could actually make? And I'm not talking about a CRNA, a nurse practitioner, someone who works in the ICU that are cutting people's chests opens and doing... No. This nurse in the Florida Bay Area made $19,954. No, $19,954 in 2 weeks. 2 weeks. Made 20 grand in 2 weeks. Working 8 shifts. In 8 shifts, they made this much moolah. That is absolutely insane. There's a picture, it went viral on Facebook. You'll see it right here. It's gonna be somewhere here. But the picture of the pay stub. But oh my goodness, that's a lot of money for that's a lot of money to make in 2 weeks. And if you're a millionaire, you make, is that your regular paycheck? Good for you. If you're like a doctor, if you're making a lot of money, congratulations, good for you. But I'm saying, compared to what nurses make, the average nurse, that is an insane amount of money. And you want to know how they did this? So this is, a lot of people are obviously questioning, is this real? Who knows? But if you do the math, and they did the explanation in the comment section of the picture, and it does make sense, all right? So it goes. They said in the comment of the picture, a fellow nurse posted this: for everyone inquiring, the check stub is from a nurse who also happens to work as a PRN in Northern California, the Bay Area. She worked 8 16-hour shifts in 2 weeks time frame, making over $100 an hour. This is how. In the Bay Area, anything over 12 hours in each shift is double pay, and she did 16 hours each of the 8 shifts within the 2 week time frame. So at the most, 4 shifts a week. I wouldn't tell anyone to just go into nursing for the money, or you will fail. I agree 1,000%. But if this is your passion, then the sky is the limit. If you can't comprehend the simple math, then this is clearly not for you. So, at 12 hours, she did 8 16-hour shifts. Everything over 12 hours is double pay. You get paid double, right? Not time and a half, double, right? Congratulations. I just have to say congratulations, and I like those last 2 sentences. Definitely don't go into nursing for the money, and I'm afraid people might go into nursing after watching this video for the money, but that's insane. Understand something, right? I've done probably 3, 4, maybe 5 16-hour shifts in my entire life. Number one, they definitely weren't paying that much. $100 an hour is humongous. And side note, they said specifically the Bay Area because they pay the highest amount in nursing for nurses in the Bay Area, because California cost of living is $1 million. Like, it's insane. You get that kind of money making it in the Bay Area if you're just working regular hours is, yeah, you're making it, you're living, you're doing well, but you're also just doing just as well as a nurse in Massachusetts making the average over here, which is not $100 an hour. Anyways, I've worked like 4, 5, 16-hour shifts my entire nursing career, and geez and Lord, it hurts. When I come home after a 12-hour shift and I'm on my hands and knees just looking for my pillow because I can't even keep my eyes open on the drive home, to know that you did 16-hour shifts 4 times that week, and then the next week you did 4 more 16-hour shifts, you're a champ. Might be unsafe. We talk about burnout all the time as nurses. That is how you end up doing burnout. But if you plan this ahead, if you did like your timing, if you went home and you slept, you live across the street from the hospital, you go there, you sleep, you come back in, like, if that's what you did, if you did it right, if you were safe, which is the number one concern here, if you were safe to both the patients and yourself, I am all for it. You work those 16-hour shifts, you make that money, make that goddamn shit rain. You go, girl, you go, because that shit is real. I have to say, question of the day, would you guys do 4 16-hour shifts a week? That means 8 16-hour shifts within your pay period to make that $19,000, $20,000? Please answer in the comment section below. I would love to know, because that is a lot. And for you, and this is specifically for nurses or healthcare workers that do 12-hour shifts, please let me know. Because I don't want people being like, hell yeah. Side note, I've never done a 12-hour shift in my life. No, I want to know if you would work that many hours as a nurse, as a healthcare provider in a hospital to make that kind of money. My answer is absolutely not. I would probably do 1 16-hour shift, go home with a check, obviously not that fat. And they also must have been paying, like, doing bonuses on top of the doubles. Because, I don't know. We'll figure out the math later. That's not important. The point is, if you're safe, if your patients are safe, if your coworkers are safe, and you can work 100 million hours a week, you do you, boo-boo, and you make that shit rain, baby. Make that shit rain. All right. I'll catch you later. Thank you. Deuces. Oh, no. Please, don't forget to like and subscribe. Your boy Q the Nurse here is very excited. I've had a huge growth in the past, I'd say 3 to 4 months. I went from 500 subscribers to 1,200, 1,300, which makes my heart sing. You guys are absolutely amazing. I just want to continue to grow. I mean, 5,000 now is my next goal. Yes, 5,000 people, 5,000 subscribers. That is the goal. If there's something I'm doing right, let me know. If there's something I'm doing wrong, please let me know, right? I'd rather just be average with things being all right here, good there, all right here, good there, instead of me doing things that are some are good and some are horrible. I want to get rid of the horrible and let's get the good up there, right? Let's get the rest up to the good area. So, like, subscribe, but like I always say, if you're going to like and if you are going to subscribe, I beg and plead of you, please leave a comment about the stories, about nursing, about any of that stuff, or just about this pretty face and how I can make this better for you. Please and thank you. Deuces.